Beautiful. We are on. All right. Welcome back to the Fertility Frequency Podcast. I am your host, Kirsty, and today I am joined by the beautiful Sharon Pitardi. She is a beautiful acupuncturist and Oriental Medicine practitioner, and she has this really beautiful passion for fertility, pregnancy, postpartum care, and pediatrics. Sharon practices at the Healthful Wellness Hub in Glenelg in Adelaide, South Australia. And what I love about her work is that it's not just clinical. She's also trained in psychology, and she brings this beautiful whole person approach to her clients. And I think a real beautiful testament to the work that she does in this world is the amazing results and the transformations that she gets to, support throughout this journey of becoming mother. So, Sharon, welcome. Thank you so much for being here.
Thank you for having me. I'm so excited to chat with you today.
Me too. I'm really excited to see where this conversation goes,
hmm
and just allow it to be as fluid as we need. But also, there's a few beautiful points that I really would love to dive in with you today as
hmm
well. So, your beautiful path into Chinese medicine, firstly, um, that actually started with your own experience, with your own women's health journey and your own fertility journey. Can you take us back there just for a little minute around, if you feel called to share, and then how that interwove into the work that you do
hmm
today?
Yeah, so I really wanted to be pregnant at a certain time in my life, and I got pregnant really quickly, and then unfortunately had a miscarriage. And I didn't miscarry naturally, and ended up needing to go and have a D&C. And then I think from there, my body had absolutely no idea what had just happened. And I went through probably 6 months of no cycles. If I was taking a pregnancy test, I'd still be technically pregnant, but obviously not. Migraines every day. My body just had no idea what was going on. And a friend of mine said, you should try acupuncture. And I'd had acupuncture before when I was younger, but hadn't really ever thought of it in this way. And went to see this beautiful practitioner that specialized in pregnancy and fertility. And that minute that needle went in, it was like an epiphany. It was like a calling. I call it like the wild call of acupuncture. I just knew that I wanted to do this medicine. So I made a kind of a pact with myself there and then that if I fell pregnant and had a baby, that I would go on and study this. And so that's what happened. I was pregnant 3 months later and had my son, and then started studying pretty part-time because it's a very rigorous degree. And it took me about 8 years. So I studied through working part-time through both of my children. And I just felt so called from that minute onwards. I knew that I always wanted to do fertility. It was going to be a big part of my practice, and that I really wanted to treat children as well. So that's pretty much what I focus on now.
I love that. It's like a simultaneous calling almost, wasn't it? Of like, you need to birth, you have this deeper desire to birth and mother a child, but also this deeper calling of like, I desire to birth, this part of me, and like this calling, this soul calling often we get that often has to be birthed through the womb as well, which is
And
really,
and birth through challenges as well. Like I think, that's what came out of that. I was in such a difficult place. I really had, and I think back now and I think, my goodness, I had no idea really. It really wasn't that hard, but it felt so huge, emotionally. It felt like such a barrier. And then seeing what this beautiful medicine, how that can soften you into the place that you need to be, and how you can just tweak a few little things, and then all of a sudden you're pregnant, and you have a beautiful pregnancy, and then you have a beautiful labor, and then you have a beautiful postpartum, because the medicine really it supports at every level.
yeah, absolutely. I can so attest to that myself on my own personal acupuncture journey. Like, it's the way in which it just interweaves into your world, and it just, you do have those epiphany moments of like, oh, this is what my body can feel like when it's fully balanced,
hmm
when it's aligned, when everything is working and speaking to each other. It's
hmm
like symbiotic level it's just really becomes really potent and powerful, that I feel like sometimes it just gets overlooked. I don't know if you've ever
Mm.
done that too sometimes, but you also have a beautiful background in psychology as well.
Hmm.
And so, what drew you to bring those modalities is not quite the right word, but what drew you to bring them together in that sense? How do you feel like you bring both of those worlds into your
Mm.
practice?
I think, fertility is hard. And I'm sure you can attest to that with the beautiful clients that you see, but it's a really hard journey. It's a really hard thing for a couple to face and for a woman to face. And I think having the psychology side, understanding behavior, the things that we tell ourselves, the stories that we tell ourselves, the places where our mind goes when we're faced with those challenges. It helps me understand, what a woman and what a couple is facing. And I think that can be really helpful in terms of how we use language, how we use stories. A lot of the time I pick up things in the pulse about a woman's childhood, her own relationship with her mother, and what mothering means to her, what the projection is that she is putting on herself about what it is to be a mother. And sometimes those blockages are actually greater than the physiological blockages, which I'm sure you can talk about as well. And I think having that psychology hat, kind of allows me to find that language and say, do you think that the way that you're using these words or the way you're talking about your journey maybe is impacting how open you are to this happening, or how much you trust your body. Your body can do this. It just needs a bit of help.
Absolutely. Yeah, I so resonate with that. It's taking that whole mind, body, spirit component and reweaving that trust within a woman's body, but actually also going to those deeper layers of, okay, what is held here beneath the surface? What's in the undercurrent of the subconscious that actually is the truth of perhaps
Hmm.
why the conception isn't happening or the pregnancy is not holding?
Hmm.
And then journeying into those terrains really allows a woman to see, oh, actually, there's nothing physically, out of proportion or wrong. I don't like using that word either, but
Mm.
if there's nothing actually stopping you on that physiological level from conceiving, it's actually the emotional undercurrents or those imprints that we find
Mm.
are the parts that are stopping us. And mother wounds are big ones that I too find in working with women in that fertility realm, is those belief systems of I do not want to mother like I was mothered, and
Hmm. Yeah.
that fear factor as well of, am I actually going to do a good enough job, or am I
Hmm.
capable of holding that this big role of mother, because it is overwhelming sometimes. You think, how can I hold another life in my hands and actually bring them up in this society right now? So
Mm.
yeah, I love that. I love that you interweave all of that as well. It's really important. Mm, beautiful. There was also another piece that we've kind of shared a few little musings together already, and um, it kind of, I think it builds upon what we've just been talking about when you say you often find that when women are struggling to fall pregnant, it's
Mm.
this part of us within us that we can't help but take it personally, that we feel like
Mm.
our bodies are failing. And the part that I resonate with what you said was around, it's your body asking for deeper support.
Mm.
And I feel like that's something that we can dive into just that little bit more, because you've given that beautiful example of those mother wounds and those other components that we see in the fertility realm. Is there anything else that you feel called to share around when a woman perhaps is faced with this feeling of she is having this difficulty in conceiving, and how do we reframe and rewire those thoughts within her to share with her that your body actually isn't failing? She's actually just has so much information to share with you. It's not about,
Mm.
coming back in and listening.
Mm.
I'd love to hear a little bit more about your perspective about perhaps some transformations without obviously giving
Mhm.
any identifying information, but just some examples perhaps that you've encountered that
Yeah.
or
Yeah, I think and I have that a lot. I have women sitting opposite me in tears saying, I just don't think this is going to happen for me and my partner. Like, I can't do it. Like my body just. And I like to kind of flip the switch a bit and think of it. And I give them this really silly analogy, but I think it's really helpful. And it's this idea of like we're baking a cake. Okay, we're going to bake this beautiful cake. We need the cake to rise, right? We need to put it in the oven. It needs to rise. When we bake a cake, we need all the ingredients, right? We need, eggs, we need flour, we need butter, we need the oven to be working and be at a good temperature so the cake can rise. And I think Western medicine tends to come in from that level. It goes, infertility, it goes, is there sperm? Is there an egg? Is there a uterus? Right, let's go. Right. That's not the right question a lot of the time. It's yes, we have the ingredients, but what is the quality of those ingredients? What is the quality of a woman's cycle? What's the quality of her uterus? What are her periods like? What is the sperm like? And this is often one that is missed a lot and is a huge issue at the moment. And we can go into speaking about that in a minute, but it's almost like we ask the wrong questions. We don't go deep enough. And so once we start saying, okay, don't look at this as you're failing, look at this as, what do we need to tweak? What do we need to do in putting that cake together? Do we need to work on that egg quality? Do we need to work on the sperm? Do we need to work on your uterus? Let's look for deeper levels of support. And see what's out of harmony, what's not in harmony that we need to bring back together. And often when we start to do that work, and it can be so simple, it can be that a woman just doesn't have enough blood. She doesn't have enough blood, so she's barely keeping herself alive. She's not going to make another human and be able to support a pregnancy if you don't have enough blood. Very, very common, very, very common. And so a lot of the times the things are not monumental. They're just little tweaks that we need some time for the body to come back in harmony. That's not failure. That's just we're asking the wrong questions.
Yeah, I totally agree. And it is that reframe of actually
Mm,
how much deeper can we journey within ourselves and actually begin to look at the embodiment of self and actually who we are as women
yeah,
rather
yeah.
than bypassing, these deeper aspects. And some people will feel like, oh, it's just way too much, like we shouldn't have to do that in to conceive a baby. But oftentimes, this perhaps was where my spiritual perspective comes in, is the energy of these beautiful babies that are coming in now actually require a lot more of our mums. They're actually asking so much more of their well-being. They want to have a clear,
Mhm.
energetically clear vessel for them to land and to thrive. And they don't want to be carrying that emotional, energetic baggage that is held within their wombs, the stagnancy held within their energy and their life force. Like,
Mhm.
it's when you think about it too, it's kind of like if you put too much of one ingredient in the cake, it's actually going to ruin it and it's actually going to stop it from rising. If I suppose if we can continue that cake analogy,
Yeah.
it's like when we have too much flour, the cake becomes really dense and
Dense.
heavy.
Yeah.
And that is kind of what I would attest to, what I see in my space as well when I work with women, is there's so much density and stagnancy in a woman's womb that it's like there's just no space actually for a new
Hmm.
life to thrive in that space at all.
Hmm.
So yeah, making sure we clean the oven too and
Yeah.
make sure we
That it
make
can
the
get up to a
ingredients
good
right.
temperature.
Exactly. Um, oh, I feel like we've just so got on a beautiful tangent there. It is. It's about having those little tweaks, but also having someone to be a support to hold you, to walk with you on this path,
Hmm.
because
Hmm.
that is not something to be ashamed of either. To
Hmm.
say, I actually actively trying to prepare my body, my mind, and my spirit for conception. And it's not a path that we walk alone anymore. It's not something that we just like, oh yeah, I think I know when I'm ovulating. We're just gonna try here. It's actually this like more co-creative energy. I find that women are starting to become a bit more proactive in how they're preparing their body before they're even getting to that conception stage,
Mm.
which I feel like this is the beauty of acupuncture as well. And, Chinese medicine, where we get to just come into that, deeper richness of aliveness of self too, not only to prepare our body for pregnancy, but to come back into harmony with us as women.
Yeah. Because, very rarely do I see a woman in clinic and she says to me, I feel great. Like I've got great energy. My periods are great. Like they're not painful. They come every 28 days, but I just can't get pregnant. I mean, that doesn't happen, right? And what you were saying before, why are people needing to put so much more into fertility now? I think it's because women are so depleted. We carry so much of that mental, emotional load as well. A lot of the times when we're having children, we're older, we've got career stress, we're managing a household, we've got mental load. A lot of women come to me quite depleted. And that's really the beauty about Chinese medicine, because the fertility is really just a symptom of what is going on at a much deeper level. And so once we start fixing what is out of harmony, guess what? Yeah, their headaches go and they have more energy and they're sleeping and they're not cold anymore, because fertility isn't the actual disease. It's just that fire alarm going off saying, there's a fire here. Can you get to the fire? And that's why I think we also have, we can get so much deeper and we can have breakthroughs, is because we're getting to that underlying root of the issue. We're not just bypassing it and saying, right, you've got a fertility issue, we're just going to hit it with this drug, or, we're going to go to, get some an IVF and we're just going to do this protocol. We're actually understanding, well, what is out of balance for you? And a lot of the times I'll see, five women, they might all be very similar ages. They might all have been trying for the same amount of time, but I can guarantee you that their acupuncture points, their herbal medicine, their supplements will be completely different, because there are different disharmonies, there are different blockages, there are different deficiencies there that are causing that fertility issue.
Absolutely. And when we begin to just, reconnect with self too, this is the part that we actually become so much more attuned to what our intuition is actually telling us to, and allowing us to
Absolutely.
be in that sovereignty of like, oh, actually, okay, I can hear, I can feel, I can sense what it is that my body's needing too. Like, yeah, it is really, I think this is a great space to be in this sphere as
Mm.
well, of allowing women to come back home to themselves beforehand and allow
Absolutely.
help.
It's such an honor to work with women, because a lot of the time I'll have them say to me, "Oh my gosh, like I didn't realize that that's what that meant." Or, when I get them, I might get them to chart their temperature, for example, because it gives us such great data around what is happening to their hormones, where they're ovulating. And they're like, "I wish someone had told me this. I wish that I knew this when I was going through high school, or where I was having, really bad period pain, or I wish I understood my body in that sense." And I think, you know, modern medicine has done so many things, but we're so much more disconnected from ourselves as women. And when we take that power back, and when we can see that change, we can see a change in the chart, or we can see a change in our symptoms, women feel so much more empowered. They feel like, oh, I kind of understand why this is happening now. Whether a lot of the time they come to me really confused, they've lost a lot of hope, they don't understand why it's not happening for them, because no one's really taken them time to explain it to them. And they feel, yeah, really helpless.
Yeah. And that sense of empowerment really can run, you know, a whole different trajectory when a woman then becomes so much more in tune with her cycle, with the way in which her temperature will fluctuate
Hmm.
throughout her journey through menstruation, and throughout the other cycles within us. It is it's it's this sense of liberation, and also this sense of um, why have we been so shamed as well about actually speaking about this openly, actually having a bit of a deeper connection and reverence to what our periods do share with us each and every month. Like, it's like a report card, isn't it, of
Yeah.
like, how is my body, how is my body thriving, how does she actually need more tending by the quality of our blood each and every month, or what maybe the symptoms we're experiencing. It's like that reflection of like, oh, maybe I should have just taken a little bit more time to rest last cycle, or
Hmm.
perhaps looked at my diet and well-being in a different lens. It's like, okay, let's see how we can change this. It's really does become empowering. I so agree with that
Mm.
part too. And why is this not taught in school?
Yeah, I
I
know.
just This is the conversations that I know I too will be having with my daughter. We're already having that, and she's 8, right? But I think that these are the openings of conversations of allowing women to come back home to their own inner rhythms. as well.
Absolutely. And, it's so much easier for women now because there's, I mean, I'm not a huge fan of AI, but there's so much more technology that allows us to do more of that charting. There's the temp drop and lots of really good wearables and stuff that make it really easy because some women come to me and they feel really overwhelmed. And then I'm asking them to do more things. I'm asking them to take the temperature and then they get stressed because it's going up or it's when it should be down and for some women, that's not a good space for them to be in. And so then we talk about, well, how can we take that pressure away and still get the information? And now it's really easy. Like now you can just go to bed with an armband and it does it all for you. You don't even have to look at it. And then you just show someone like myself. And, sometimes I don't even talk to women about it. I just say, yep, this is what I'm seeing, but we don't have to always break everything down because some women, it can be really overwhelming for them. But it's so empowering to do. And, I think there's a trajectory out there now that, it's normal to have painful periods. It's normal to have heavy periods. Lots of girls have this. We've flipped this conversation from it being common and somehow because it's common, making it normal. And the amount of women that I talk to and say, that's really not a great period. That's telling a lot about your blood. Like we shouldn't be seeing those clots. We shouldn't be seeing you flooding through pads or, bleeding heavily at night, that you're needing to change in the middle of the night. That is telling me that something off. And they're like, really? Like this has just always been my cycle, so that education, with our own children and our own young women about that's not normal. Like it's common, but it's not normal.
Yeah, exactly. And bringing that conversation to the table is so important too, isn't it? When, you know, our menstruation has often been kept in the undercurrent, hasn't it? It's not
Hmm.
really something that is projected out into society or normalized or embraced, really. Like it's gone the other way where it's been hidden and shamed and often,
Absolutely.
secluded. And how do we know what is normal or not, or let's say optimal and not as
Hmm.
optimal? I think I
Yeah,
like that. Those
absolutely.
words better.
Yeah.
Um, how do we then know what is optimal and what is not? And I think the amount of suffering that some of us women do encounter, it's a lot. And
Hmm.
it becomes exhausting. So I can see why some women would find that, oh, I need to track, my
Hmm.
temperature again, and
Mm.
find that as an overwhelming part, especially when we're working with a woman's nervous system and her stress responses too. Like that's a
Hmm.
really fine line of, adding more, but not overwhelming her and pushing her over that edge as well. Like, yeah, our nervous systems and obviously our kidneys are really, really important in this
Yeah.
path too. Um, Now, some women, they will conceive, right, which is amazing. And
Hmm.
they get that beautiful positive pregnancy test. And then, unfortunately, maybe a few weeks later, or they might get to that 12-week scan, and their body's ability to hold that pregnancy,
Hmm.
um, unfortunately, isn't able to be fulfilled.
Hmm.
How do you feel like you approach recurrent loss in your practice and what you see with women in your space?
Yeah, I'm probably going to get a bit techie on you now, but recurrent miscarriage is a really big field. So, it can really span from quite simple, easy to see things to quite complex kind of genetic stuff. So, whenever I work with recurrent miscarriage, we almost start from the beginning again and say, right, okay, you can get pregnant, but when are you losing? And a lot of pregnancies, if they're lost before 8 weeks, we really have to question sperm in that. Sperm is a huge, huge factor, irrespective at the moment in the West, but it's extremely important in recurrent miscarriage under 8 weeks. And this is around some of the, I suppose the science we now know about sperm. Many years ago, we used to think that sperm was only important for fertilizing that egg. So it came along, it fertilized the egg, and then that embryo went and implanted and went on its merry way. Now we know that the DNA from the sperm actually helps that embryo divide over those first couple of weeks, helps that embryo implant into the lining of the uterus, and actually helps a woman's placenta form. So we are really reliant on that sperm more than we ever thought. So, and you see this in IVF as well. You'll see women go off to IVF, they'll get a really good egg collection and they'll fertilize, let's say 7 or 8 eggs, but then they'll all die off, or a lot of them will die off before day 3, day 5. That often is a sperm issue. Okay. So, and so many times I have couples sit in front of me and say, "Oh, I've been told sperm's fine. My primary carer said it's fine." Or they'll have the opposite. "I've been told it's terrible." And just to go straight to IVF. And that's really frustrating because sperm is actually fairly easy to work with. It's made fairly quickly by a man's body. There's a lot more moving parts with women. Women have a cycle, they've got hormones, they've got egg quality, they've got ovulation timing, they've got your uterus. Men, it's just sperm, right? And so you can affect a lot through diet, lifestyle, through, supplements and herbs. You can actually get sperm to come really good in a short amount of time. So a lot of these women, unfortunately, that are having, 3 or 4 miscarriages before someone will take them seriously and start to actually investigate deeper, it's really frustrating because a lot of the times, if we just work on sperm alone, we can get a much better result. If women are tending to miscarry above 8 weeks, then that can often be an undiagnosed autoimmune condition. So things like thyroid antibodies, thyroid conditions, and that in itself, that is a huge area. And I see that as being one of the most undiagnosed things when people come to see me. Their thyroids have never been checked in detail and they've never been checked for thyroid antibodies. And we have to remember when we go into an autoimmune picture, the body is attacking itself. So it's seeing that embryo as self but not self. And often it will attack it. And so you don't get, you can't hold a pregnancy. So we want to be looking at things like a full thyroid picture, antibodies. We want to be testing for things like clotting factors that often have a part to play past 8 weeks as well. A really common one is something that's quite simple, and that's blood deficiency. So women don't have enough blood. Often this will overlap with a ferritin deficiency, so anemia or iron deficiency in Western medicine. And so there's just not enough blood to grow that embryo until the placenta can take over. And a lot of the time, women have been told, yeah, your iron's a bit low, but you're okay. You need your body to have a lot of blood in reserve to be able to grow another human, make another human, and grow another human. So sometimes recurrent miscarriage is just about this woman is really depleted and we just need to build that back up. Sometimes it's more the uterus itself is scarred, stagnated, there's antibodies, so there's an autoimmune picture, and we need to work with that. Clotting factors, sometimes, if there's a clotting factor, then they can really benefit then from, some anti-clotting agents, and often, but unfortunately, women sometimes are needing to have 3 or 4 miscarriages before they get to the point where this is being investigated.
Mm.
So it's a big one, recurrent miscarriage. And that's where I think, working with someone like myself or, a fertility naturopath can really help because we start to ask these different questions about what could be happening.
Absolutely. And it's not just, okay, well, this didn't work. Let's just beeline it and go straight to the alternative. And I mean, even in that space, it's the emotional turmoil that
Mhm.
a couple can face when they are experiencing, multiple losses. It's like that undercurrent of grief that you still have to also attend to
Mhm.
because, that's layering upon layering of all the pieces that, you know, that hope and that enjoyment of the journey of conceiving, it just becomes more and more diminished, I would imagine, over that time. And I've seen that women I've journeyed with, they are just lost. They are just like, I'm defeated, I don't know what
Mhm.
else I can do. And then they're looking down that barrel of IVF, and it's like, okay, actually, let's can is there a scope, or is there a potential that we could just pause for a little moment,
Mhm.
actually let's go and see practitioners like yourself that can actually support a woman to just actually see, like, let's have a little inventory, let's do a recap and actually see what perhaps is here for us in this moment in time. Like, I suppose that's perhaps where we can blend so beautifully. I can support women on that emotional, spiritual side of the grief and the sadness, and
Absolutely.
you can support them through that. Like, okay, let's look at, is your thyroid antibodies, a little bit off kilter here? Is there some iron deficiency and ferritin stuff
Mhm.
happening that, like you said in the beginning, sometimes these are little tweaks, and sometimes it's just those little parts that will allow things to just then happen.
Yeah. And, often I think your work is so useful when women do finally fall pregnant and they are, approaching the time when they have had losses before. The story that they tell themselves and I find with a lot of recurrent miscarriage clients, they don't really start to relax and enjoy their pregnancy until they're kind of around that 20 weeks when they can feel the baby and it really robs them, I think, of that experience of being pregnant. But you understand it, right? Because they've had so many losses that the hope is, they've really closed off that heart until, they get to a place where they feel like, okay, I can start really opening my heart back up again. And I feel it all the time in the pulse. And I'll say to them, it's okay to be happy. It's okay to rejoice every day that we have this pregnancy goes forward. And a lot of the times I see that they're going to hold because we've changed enough and we can see it. We've seen that change in the chart. And so, I can hold that space for them, but sometimes it's then believing in themselves. And that's where I think your work can be so beautiful because you can get into that unconscious level of, that fear that they're holding on to and that ability to close off their heart that they don't want to experience it just in case it doesn't go well.
Absolutely. And that in itself can be so constricting in a woman's energy as well, even, if they have experienced those recurrent losses as well.
Mm,
It is that constriction of energy that is in that prevention mode of not allowing them to conceive.
mm,
That's sometimes on that energetic level that I see with women. And, you know, it is this closing of the heart that often happens, not to a fault of a woman, but to the protection of our own inner hurt and the disappointment that we can then face. And, that's where we probably work similarly in the fact of working with those beautiful meridians like the bowel line meridian and the conception vessels and all of
mhm.
those to optimize and just reconnect a woman back
Yeah.
into those beautiful flows of energy that then allow that softening, that awakening and re-centering, I suppose, of how we can give ourselves permission to enjoy the journey,
Hmm.
whatever that looks like. But you know, it is, we so see it that it is difficult for some women to remain open hearted when in
Mm,
the depths of those grief. But this is, why we have these spaces to hold you through that grief, to witness that grief rather than just burying it back down month
mm.
after month. But um, what are is there any specific things that you see in your clinic space in relation to what grief looks like in the body, how that is kind of held within the body? Anything
Mm.
else that you would like to share with us about? Yes, we have the pulse as a guidance, but is there anything else you feel called to share?
I think a lot of women that are going through a fertility journey have grief. Like it's just that grief of that expecting that they would be pregnant, that they would have a family by now, that things would look different. So grief is something I feel constantly in the pulse. And as you said, it makes a lot of sense. And then there are times, and I'm sure that you agree, you see this as well when you talk to beautiful babies on the other side, is that there is a divine timing to when babies come. And, sometimes I'll work with a couple and we'll be working with each other for, 3 or 4 months and everything's looking really good. Charts looking really good. Periods really change. We've spent some time looking at sperm and it doesn't happen and it's not happening. And you're like, right, let's dig deeper. And I'll never forget, I had this one client and I would pick up all this grief in her pulse every time I treated her. And I'd talk to her about it a bit. And I thought it was really because of what was happening in treatment. It was just taking a while to happen. But then it continued to happen even after we had changed a lot of things and she was seeing a lot of really positive signs in her cycle and we'd spent the time working on sperm and I could constantly feel this grief in her pulse. And I said to her, look, let me have another look at your tongue. And she stuck out her tongue and she had this really deep crack in her in her conception vessel, what is reflected in the conception vessel on the tongue. And it was almost like hollowed out and like pale around that central line of the tongue. And I had kind of missed it because, to be honest, when I do fertility, I'm wearing so many hats. I'm like, Western medicine stuff, Chinese medicine stuff. We're looking at all this data. And I just had this overwhelming call, and I said to her, "What's your relationship like with your mum?" And I get goosebumps now thinking about it. She literally just sobbed, like absolutely sobbed on the table. She couldn't even get a word out for 10 minutes. And I just sat with her. I just put my hand on her. And when she finally calmed down, she just said, I had the most awful upbringing. I haven't been able to forgive my mother for what she's put me through. And I'm just so scared of becoming her. Right. And it was like, wow, this is it. This is what's sitting in that body. This is what's sitting in that connection between the heart and the uterus. This is the REN channel, the conception vessel. This is what it's holding, right? This story that you're telling yourself that you're going to be the same as her. And I said to her, look, I think take a break from me. Everything that we have been able to do, we've done. You're in the best shape physiologically that you can be. Your partner's great. Get some healing, cut some ties, get some womb healing, because this is much, much deeper. And she messaged me a couple of months later saying, I went and did all that stuff and I'm pregnant, and can I come back and see you for postpartum? And it just it just reminds us that, this work is so deep. And sometimes those babies don't come, as you said, because they want you to have cleared your shit. They want you to have cleared your baggage. They want you to have a new relationship and a new, set up a new cycle, break that cycle that's happening. And you do see that emotional a lot in the body. You see it in the condition of the uterus, a lot of what you were saying before about stagnation. You see that a lot in these, kind of brown, clotty periods where women are not able to let go. And working with that emotion at a deeper level can really help prime that body and clear the energy in the body so that we can become, better balanced, really.
Yeah, absolutely. And it's really it's nice to hear stories like that too, because it just goes to show we can be doing everything, as per the book, whatever the book might say. But then there often is that little undercurrent that is just asking us to journey that little bit deeper.
Deeper. And the opposite happens as well. Like sometimes I work with couples, and I'm like, wow, the sperm's really not great. And she's got terrible periods. Her periods are really painful, really clotty. We don't know when she's ovulating, cycles are everywhere. Wow, yeah, okay. So we start small, let's just start changing a few things. Let's start charting, let's start getting you on some herbs. And then they're like pregnant in like 2 months. And you're like, what? I'm shocked by it. I'm shocked. Like, I'm like, wow, it's babies come. There's a divine timing as well.
Absolutely, there is. Often I will hear that when I communicate with spirit babies, is it's like, okay, well, some of these themes need to happen and occur, but and then sometimes I will just hear like a month. And the amount of messages that I've received from beautiful clients that, they'll message me and they're like, oh, you said September and we're due in September. And it's like, wow, like that is amazing. Like sometimes I still get a little bit um, surprised by, the interweavings of these beautiful babies. But, you know, they do want to communicate with us too. I know that for some that's not going to resonate with everyone, but
Mm.
our spirit babies are orbiting around us well before they've even landed. Sometimes they will guide us into particular, practitioners or different
Yeah.
people or places that they really need to their mothers and their fathers to be at before they land too. So they're always, subtly trying to communicate with us, and it's just taking that pause sometimes to actually listen, and to often do that in our bodies as well, which
Mm.
in a fast-paced world that we live in right now, it's sometimes hard to pause too, which I think is the beauty of being in that receivership of whether it's some acupuncture and sessions with yourself, or coming to see me for a womb
Mhm.
healing session. Like it's that pause, right? It's that stillness of just like coming back in and just tending to your nervous system and tending to your body. Um, and so while we're on this tangent,
Mm.
what would be some practical guidance that you could share with our community if someone is thinking about trying acupuncture, especially for fertility? um, where and how should they start?
Mm. Look, if you want to have acupuncture for fertility and you haven't started trying, that is one of the best positions to be in because, we can really take that time to prepare the body properly and to look at all the things that we need to look at, to ask all those questions about, that baking that cake. Is the sperm good? And so often if you can take the time just to pause a bit and start working with someone like myself or yourself, or, sometimes people like to work with a fertility naturopath to ask those questions. What am I seeing? What maybe do we need to change? Sometimes you don't have to change much. Um, what I see more often is women that have already started the journey and that aren't getting pregnant. And it's very hard for them to hear this, but please pause. Please just let us look at what is happening. Let someone like me that's wearing a different hat, that is asking those different questions, let me have a look and see what I think is going on here. Because if nothing changes, nothing changes. We can't expect a different result. And I think a lot of women struggle because by the time they come to see me, I'm the last resort a lot of the time, like probably you are too, right? And so
Definitely.
we just want to be pregnant. We just want, why isn't this not happening? But if we can pause, if we can take a step back, you'll learn so much about yourself and your body. And you'll get a better pregnancy as well, because we will have stopped and said, right, well, we need to deal with that. We need to deal with the fact that, your adrenals are shot. You've got nothing left. You've got nothing to give here. Or we need to deal with, the fact that your husband has, 5 espressos a day and the sperm is really dried up and is not a particularly good. We need to deal with that. Like we need to, so taking that pause, it's the number one. And don't look at it as like, oh, they're preventing me from getting pregnant. We are asking the right questions so that you can actually have a different result.
Absolutely.
Yeah. And I think as well, there's a real, it's almost like an urban myth out there. And I think it comes a lot from the fertility forums that, acupuncture is useful, you know, pre and post transfer, or it's useful, to go once a month because it's good for stress and it's good for, driving blood to the uterus. This is not where the power of this medicine lies. This is not a transactional medicine. This is not come once, I'll put some needles in. You 35-year-old woman is going to have exactly the same treatment as my other 35-year-old client. You are not using the power of the medicine there. You are just using it in a transactional sense. And I actually refuse to treat people in that way. If people come to me and say, oh, my fertility specialist has said, book before and post transfer, I actually say to them, look, I think I'm doing you a disservice if I treat you in that way, because I'm not asking those questions and I'm not understanding that root cause for you, and it's not giving me any time to change it. So acupuncture for fertility requires commitment and requires consistency. And I think if you want to use it for stress relief, then great, go once a month. But I think most practitioners that do this work day in, day out will ask for that commitment. And that looks like coming weekly. It looks like taking those herbs. It looks like charting your temperature. And, there's things within that, we can work with, I can live with some things, but we need to kind of put in the work so that we can understand what's going on so that we can change it.
Absolutely. Yeah, I so hear you. It's the same in, the womb healing world too. It's some women will sit before you and they're like, you're my last hope. I've only got time for one womb healing before I go for transfer or retrieval. And you're
Yeah.
like, okay,
Okay.
this is a small stepping stone, and we
Yeah.
can only do so much,
Yeah.
in a 2-hour session. And it does require like that, but especially the different layers that potentially we've been holding and storing for years within
Mm-hmm.
our body, and within our energy, that it's not a one session wonder and we're like, oh yeah, that's great. It does take commitment, and it takes, I think this is where um, sometimes those beliefs around worthiness, about the investment that sometimes we place in, that we do need to place in optimizing our conception as well. Because if, like you said, if we're continuing to do the same things over and over and over again, but nothing's
Mm,
changing, then nothing's going to change. We
that's
need
right.
to try something a little bit different. Um, and yeah, I agree that sometimes where we come into play, we're like the last resort when
Yeah.
women are looking. But I'm like, how can we become the forefront of, before women get to this space of we've been trying for years, or we've been
Yeah.
trying for this for 6 months and nothing's happening. Like, how
Yeah.
can we begin to be in the forefront of women's mind to be like, okay, how can we incorporate, the holistic side and also the Western medicine,
Mm.
like us, allow us to be that bridge with you and walk with you in that. We're not, one
Mm.
or the other. You can't just, either choose the holistic path or, the Western medical path. We're not here to be one or the other. It's how
Mm.
can we be that bridge to support you as a woman on your individual journey and gift you that empowerment to take charge of your wellness and your capacity to conceive. Like, yeah, I just feel like it'd be so nice to be coming, a bit more front and center, wouldn't it?
Yeah, and I do think it is slowly changing, and I think unfortunately, and I'd love to get your views on this as well, but I feel like, I have sometimes I see like generations of clients. So I'll see their mum, and then, their mum will refer me their daughter who's having all these fertility issues, and the mum will say to me, "Oh, this never happened in our day. You never went and got acupuncture. You never went and you just fell pregnant." But I think, you know the energy of the universe at the moment and where people are at with their health, women are really depleted. And I see this time and time again. We can't compare ourselves to our grandparents' generation. And sperm, we touched on this briefly, but sperm has really degraded so much in the West. And, I think some of the figures that they give out is, a 30-year-old man has the sperm quality of an 80-year-old in the 90s. So we are working with much harder parameters now. And it should be part of a fertility journey to get assistance early, to come and see someone like myself or yourself, because often we can pick those things up before you're, 5 rounds into IVF, or before you've been trying for 3 years and you've kind of lost all hope. Unfortunately, I think that's the state of where we're at, modern stress, modern diets, the amount women have to do now. Um, and our environmental toxicity, it's really playing a huge part. And you see it in 9-year-olds starting periods and having breasts, right? And I see it in sperm results all the time. Healthy guys doing all the right things, and sperm is shocking,
Yeah.
absolutely shocking.
Yeah.
So, it's not a failure to come and see someone like us that can hold your hand. It's because we're prepping you for,
Yeah.
what needs to be looked at.
Exactly. And, when we think about, the quality of our environment and what we're consuming, yeah, it is vastly different to what it was back, in the days of our mothers or our grandmothers, in the way in which they conceived. And
Mm.
also, I just want to add in a little piece around, this work is not just for conception. This
Mm.
is setting you up for the longevity of your pregnancy and your postpartum. Because if you journey into your pregnancy already in that depleted state,
Hmm.
how are you then going to nurture and nourish a newborn? How do you expect your body to then produce milk, to heal optimally, to
Yeah,
allow your body to be in this state of, giving? Because postpartum, you are on 24/7, you are in that
yeah,
giving role. And so it's not just about, I'm just going to do this just to get us pregnant. This is actually setting you up for the longevity of your motherhood journey and beyond. And
absolutely. Absolutely. And, we have this saying in Chinese medicine because, blood is so important to women. Your fertility journey, your postpartum journey is actually your menopausal journey as well. It
yes,
comes up again, and it's the same factors, right? So the better you can prepare yourself for pregnancy, the better your postpartum will be, but the better your hormones will be, the rest of your cycling days will be, and actually your menopause as well. And you see that all the time. You see that all the time in women that are coming and they're having horrific menopauses. They're flooding, they've got, headaches, they're hot flush, and you ask them about their fertility journey, and there's often this huge relationship there on the quality of their blood, the quality of the kidneys, the adrenal function. It's a theme, right? And the beautiful thing about Chinese medicine, it's always, women work in these 7-year cycles, and the body will bring up what we need to deal with in those cycles. And they are the cycles of, puberty and, first period and fertility and postnatal and all the way through our trajectory as women. So looking after ourselves, I would love it if I could start seeing girls as soon as they start menstruating, because the more you can do there, the more everything else flows.
Absolutely. And, this is the significance of our rite of passage as well. Like,
Mm,
whatever happens or doesn't happen in our rite of passage becomes our rite of passage. So, you know, like you were just saying, if we're in that depleted state where we're in this conception space or in pregnancy, and then that then leads us on that trajectory of postpartum and we're already depleted, like, it's just replaying those themes until such time as, unfortunately, now we're seeing that when women get to perimenopause or menopause, they're
mm,
realizing this. And it's,
yeah.
it's like, oh, I can see the threads. And it actually, I've been doing a lot of work recently around birth imprints and actually how that then starts, from the journey of our grandmother's womb, what was happening, the epigenetics of that, of how that's interwoven into us cellularly as who we are
Mm,
as women now. Like, it began back then. But
yeah,
also, now obviously we can't change what our experiences our grandmothers and our mothers had, but the way in which we birthed, how we were birthed, is also the conduit of
absolutely.
trajectory of our lives too. Like, I feel like we'd have a whole nother podcast episode on that too. But it's just taking that, little moments of inventory to look back, and it's not extra work. It is actually just connecting to, okay, I can see the way in which my menarche was honored or not honored.
Yeah. It's investment. That's how I like it's investment. We are investing, in ourselves, that we get it right, and that, that we balance, because that balance is gonna stay with us the whole time through.
Completely. I saw. Wow. I've loved today's conversation. It has been brilliant. Is there
I
any?
wanted to ask you a lot how, when you speak to spirit babies or you work with women, how the energy of the father, I suppose, is coming through, and what people have to say about, because I think, you know, men almost have a shame around sperm, like almost like if it's something like, I don't want to get it tested because then it might say something about me and about my masculinity, or about, and often when I get men in clinic, I really talk to them about, this is just happening to everyone. This is not just you. There's things that you can do to make this better, but, we want to start treating sperm and treating you so that the quality is better, but you're also going to feel better too. Your energy is going to pick up, and you're going to, you're going to you're going to have more, longevity. It's going to feel good. And so much so that some of my guys, they've become dads now, and I'll see them in clinic and they'll be like, oh, Sharon, I'm just getting some more of that stuff because I feel so good on it. Is it all right? And I'm like, yeah, stay on it. It's going to do good for you, right? Because we're targeting something that was deficient in you, or that was stagnant, but I wonder from an energetic perspective how that comes through when you're treating women.
Absolutely. It Sometimes spirit babies will share with us tweaks that need to happen within either the union, like the relationship
Yeah.
between the mother and the father, because if there's a disconnection there or there's something that's not quite right, then the energetics of conception is not going to happen.
Hmm.
And then often I've had women come and say, like, I knew that he wasn't the right person to be a father to my child. Um, and then other times it'll be very kind of clear directions of, you guys need to perhaps go on a little bit of a detox, look at the overall health and well-being of your bodies, of the environment that you are living in. And it is sometimes, it is kind of passing messages on, like, so often I see obviously a lot more women in my space, and I really love it. This is where I'd loved when I was journeying with women through my doula support, of like actually incorporating the dads into this journey too, because it is so important. They're not a disconnected part of this journey, because they're 50-50, right? It's a
Yeah.
contribution in that collaboration. And it is about having those open conversations. But yes, sometimes it's hard to, you don't want to shame their
Hmm.
masculine side, but also being like, if we want to optimize
Hmm.
this is perhaps an avenue that we can explore. And the language is really important too,
Yeah.
I feel. Um, but also, yeah, it's really lovely to see, women feedback when I've sat in clinic with them. You know, we've had this experience through a womb healing journey or rites of passage ceremony, and they're like, oh, I went and told my husband, like, what are these pieces that came through? And now they're doing, spirit baby meditation journeys together, or, they're really actively, when they are in that intimate moment of conception, of like setting that intention of like,
Mm.
okay, we're coming back into this energy of love, which often we bypass when we're in
Yeah.
that conception mode of like, it's, duty filled. And
Yes.
we kind of sometimes lose that spark of, the joy and the passion of actually what it takes to bring a baby into the world. And so it's, yeah, some reframes that I find often
Mm.
happen there are useful for the men too. um, there was another piece that I really wanted to share, but it is so gone from my memory bank. um, but that's okay. Yeah, anything else you feel called to share before we close out for today?
I think, I get asked a lot, like, what do you see? Like, what's the most common, thing that I see in clinic from a fertility? Like, what do most people struggle with? And this, as I said, this is really hard to answer because Chinese medicine, again, is always looking for that individual pattern. But if I could give people some advice, obviously pausing, as we've talked about before, just taking a step back, seeing someone like myself or yourself, wears a different hat, ask different questions. I think that's really important. Checking the sperm, I think, is really important. And then I think there's a whole lot of women that fall into that depletion, whether that's, blood deficiency, whether that's, kidney energy, adrenal energy, whether that's thyroid. The amount of women that are walking around with an underactive thyroid, it's probably one of the most common things I see in fertility. And sometimes that goes on to become, thyroid antibodies and more that autoimmune picture. But that's really common. And I think, primary carers don't tend to really dig deep into thyroid testing. And so that's one of the first things that we might do together if you've had, some trouble falling pregnant. Um, because the amount of women that are walking around with a normal kind of thyroid score, TSH score, but then when you dig deeper and you do more testing, they're actually like their body just can't make those hormones. Like they're just really, really depleted. That's a really big one. And I suppose another tip is that BBT charting. I know I go on it about it all the time, but it is literally one of the most empowering, useful things that you can do. What is very common in a lot of women is firstly that depletion, but secondly, and you might have heard of this, is a luteal phase defect. So this is basically where after we ovulate, we should have a certain number of days in the luteal phase before we are either pregnant and hold that pregnancy or before we bleed. Lots of women have a luteal phase defect, so they don't have enough time in that luteal phase where that lining is really juicy and warm and that embryo can implant and grow, right? And so women are either conceiving and not knowing they're conceiving because they're miscarrying really early, or if it's not able to implant, and this is really common, even though your cycle might look normal. So, a woman might have a 28-day cycle. She might think she ovulates around day 15, but when we actually chart, and this is why BBT is so useful, we actually see that, she's actually ovulating around day 18, and then there's actually not enough days to hold a pregnancy. And that work is quite simple work. It's, maybe 3, 4 cycles, and then we can correct that. And so many women are missing, I think, seeing what's going on for them, seeing when they ovulate, and the chart, it gives us so much more information because we have to remember that when we're doing bloods, hormones via bloods, they're often bound to proteins. And so we're not often getting an accurate reading of estrogen. We're not often getting an accurate reading of progesterone. Things look fine, right? But often when you chart, you actually see things really clearly. You see late ovulation. You see no ovulation. So, is this PCOS that hasn't been diagnosed? You see, charts that kind of point towards blood stagnation, endometriosis. So you're actually helping yourself get to supporting a woman a lot quicker. And I know it's a lot of information, but I think if women can can find an ovulation thermometer, look it up online how to do it, it can be so empowering. And it can be when you come and see someone like myself, if you already have a number of cycles done, it can give us so much information. And what it can be really useful is that once I start treatment and once I start things like herbal formulas, the chart should change. And that's really empowering for women because they see, oh, my temperatures did go up. Like I'm not sitting under that, they're where they need to be, Sharon. And I'm like, yeah, isn't it great? And, it's that little win and they feel more hopeful. And because they're seeing that change, it feels like something is changing.
Absolutely. Sometimes it is that physical result that we get to feel like we have a piece of contribution, or we feel like we can take charge of that too.
Yeah,
That is really important as well. And even the importance of cervical mucus as
absolutely.
well. Like, actually, I think that is another piece that we could spend quite a while on, talking into. Maybe that's another episode that we get to share together. Um, but yeah, allowing us to connect into our cycles and inner rhythms, because yeah, not like you said, not every woman is going to ovulate on day 14. It's so individual, but I
Uh,
agree.
The amount of couples that I literally have fallen pregnant just because they were having sex, like they were having sex at a better time. Like they were totally missing ovulation. And those ovulation pee sticks, they're like they're like a bugbear, like because, that yeah. And so women would be like, I take it one day, it says I'm ovulating, then I take it again the next day and it's gone. And it's like, yeah, because they're not particularly accurate in terms of do you actually ovulate? So the amount of couples that literally it's nothing major. It's just literally they were having sex at a completely different time, or they were only having sex once because partner's FIFO or whatever. And it's sometimes those just tiny little aha moments that I think this is actually what's happening here. And they're like, what? Like we've been trying for years, Yeah, because you've been taking that ovulation test and it's not particularly accurate. So you're either missing the window or, it's sometimes it's really easy.
Yeah, and it's allowed to be easy. Sometimes,
Absolutely.
yeah, sometimes we overcomplicate things, but sometimes there's a need, sometimes to have multi layers within our journey, and sometimes it's a simple fix. And yeah, it can be possible, right? I think that's the part. We don't want anyone to lose hope.
That's right. Yeah.
Really important. Oh, thank you. Thank you. Thank you so much for today. Thank you for your time, your honesty, your beautiful sharings. Like, you can really see that this is a beautiful passion for you. Not only one that's personal, but also, supporting our beautiful community too. Like,
Mm.
I know that this conversation today is going to land with so many women.
Mm.
you know, Come on over and, see Sharon's Instagram. And, if you're in Adelaide, come and see her. She's amazing. But yeah, if you'd like to send me through, or actually, why don't you share with us, Sharon, where we can find you?
Yeah, so yeah, I work at Healthful Wellness Hub down at Glenelg, and my Instagram handle is Holistica Oriental Medicine. I share lots of stuff there about fertility, pregnancy, and children as well. And I will do the same. I'm going to share this obviously on my platform because I think so many times, you know that energetic work is really the missing link. And I think it can work so beautifully together. And a lot of the time, women are really scared to go that bit deeper, but that's actually where they get most of their benefit. And, as you said before, this is not separate to Western medicine, or it can work so beautifully together. And we can really empower women to have very different experiences if they do end up back in IVF or they do end up needing some support. They can feel a lot more empowered and be asking questions and be really involved in their journey.
Mm, absolutely. Because, often when women are traversing that IVF path, it feels lonely. It feels so clinical. And to have, a supportive team, like, can you imagine,
Yeah.
like, having you and I kind of in the field of like
Oh, it's a dream.
emotional,
It's a
like
dream.
spiritual support, as well as like the body side of work with, IVF clinics and places that support women on their conception journeys, like, to have that collaboration, like, allow us to hold you on that emotional level, so that you don't just feel like a number or just like a
Yeah.
vessel that things get done to you. And allow this to be like, okay, like, how can we tend to you and hold you and nurture you through this time, because it is really a sacred time in your life. And we want you to remember that this is, it doesn't have to feel dutiful or out of sense of obligation or feeling like you're failing. Like, we actually want to see you thrive. And I'm sure
Absolutely.
you can share that same heartfelt gratitude of when you receive messages from other women, the clients that we've sat with and journeyed with, and they share the exciting pregnancy news. Sometimes we're even the first ones that
Yeah,
get told, and you're like, oh my gosh, like
I know.
this is the beauty and the power of like that continuity of care, that collaboration. Like it's yeah, we're just so deeply grateful that we get to walk with women in this way too, and create that meaningful impact. So yeah, so thank you.
Thank you. What a beautiful conversation we've had today. I hope we get to do it again. It's always wonderful hearing. I mean, I think your stories are just amazing, and I always share them with women when I feel like they need a little bit more support. And I think some people are hesitant to, as we said before, to go deeper, but the benefits that it can bring you for the rest of your life are just huge.
Absolutely. And just because we might journey deep doesn't mean it has to be, it's not traumatizing, it's not, scary in that facet. It's so deeply supportive. And the amount of
Mm.
aha moments that women receive through that, it's phenomenal. It's like pieces of the puzzle just like instantly click and they're like,
Yeah,
ah, it makes so
yeah,
much
yeah.
sense. So, oh yes, I can't wait for us to do this again. Thank you so much for being here. And
Thank you, beautiful.
until next time,
See you later. All my love.
bye.